the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. Pneumonia symptoms in elderly people. When it comes to pneumonia in older adults, recognizing the symptoms early can significantly influence their recovery and increase their likelihood of survival. As a caregiver, knowing how to spot the signs of pneumonia in elderly adults is crucial because their symptoms often differ from the classic indicators seen in younger populations. Let's review the common pneumonia symptoms and how they tend to present in older adults. Make sure you also consult with your loved one's primary care physician, as they may have more tailored advice for you and your family. Pneumonia symptom number 1, confusion and delirium. One of the most common symptoms of pneumonia in older adults is confusion or delirium. Instead of the usual fever or cough, elderly individuals might exhibit sudden changes in mental clarity. Pneumonia symptom number 2, weakness and unsteadiness. Weakness and unsteadiness can also be symptoms of pneumonia in elderly individuals. These symptoms pose a high risk because they can lead to falls and subsequent injuries. Pneumonia symptom number 3, breathing difficulties and/or chest pain. Shortness of breath and rapid breathing are critical signs of pneumonia in elderly people. These symptoms signify that the lungs are struggling, indicating a potential for decreased oxygen levels. Chest pain is another concerning symptom, often exacerbated by deep breathing or coughing. Pneumonia symptom number 4, coughing and temperature changes. A cough with or without mucus is a traditional symptom of pneumonia, but can be less pronounced in the elderly. These symptoms often mask the presence of fever or chills, which are typical pneumonia indicators but may be absent in older adults. Risk factors of pneumonia. In addition to understanding the symptoms of pneumonia, it's also important to be aware of the typical factors that can increase the likelihood of someone developing this lung infection. The American Lung Association has identified 3 categories of risk factors for pneumonia: medical conditions, health behaviors, and environments. The medical conditions include chronic lung diseases such as COPD, bronchiostasis, or cystic fibrosis. It includes heart disease, diabetes, sickle cell disease, weakened immune systems by possibly HIV and AIDS, an organ transplant, chemotherapy, or long-term steroid use. Difficulty swallowing due to stroke, dementia, or Parkinson's disease. Recent viral respiratory infection, cold, laryngitis, or influenza. And finally, hospitalization, especially when in intensive care and using a ventilator to breathe. Health behaviors include cigarette smoking, drug abuse, or alcohol abuse. Environmental factors include exposure to certain chemicals, pollutants, or toxic fumes, and exposure to secondhand smoke. Treating pneumonia in older adults. Depending on the patient's overall health and any underlying medical conditions, recovery from pneumonia can take weeks or months. Treatment can take place at home with plenty of rest and hydration. If bacteria causes the pneumonia, doctors may prescribe antibiotics. Severe cases will need to be treated in a healthcare facility. If you suspect an older person in your care has pneumonia, get treatment, especially if they have underlying health conditions or symptoms and they're getting worse and not improving. Pneumonia prevention for elderly people. Bacteria or viruses typically cause pneumonia. It can be contracted by contact with other people, so it's recommended that people follow good hygiene practices such as hand washing and disinfecting high-touch surfaces. Staying up to date on vaccines, including the flu shot, is also critical. At Best Care, we are dedicated to providing the necessary support and information for family caregivers. We are here to assist you in ensuring the health and comfort of your loved ones. If you find this podcast helpful, share this with a friend leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.